Hi everyone, I hope you're all having a wonderful week so far. Today is episode 4 of True Crime Time, and in this episode, I'm going to be talking to you about a case which is very infamous within the UK. If you ask anyone in the UK to make a list of serial killers, they will for sure put this person down on that list, especially the older generation. Once again, this episode was recorded live over on Twitch, so be sure to give me a follow over there to make sure you're one of the first to watch. You can find the links on the screen right now or in the description box down below. Also, I would really appreciate it if you give this video a like to show that you enjoy my true crime content, and subscribe to me here on YouTube too. Before we get into today's case, I just want to give my usual disclaimer. All of the information that we will be talking about today is information that I have gathered from the internet through research conducted on readily available sources. Although I try my hardest to make sure that all of the information I include is correct, please be aware that there may be some errors or gaps in the information, and this is due to limited or conflicting sources. There isn't much of a trigger warning for today's case, thankfully, as there isn't too much detail into the methods of which we used. But I do want to mention that this case does include mentions of abuse of the elderly, as well as drug addiction. So if this is something you don't want to listen to, I completely understand. Please click off the video, and hopefully next week's video will be something more suitable for you. So, without further ado, let's get into today's case. Today's case, we're going to be talking about Dr. Harold Shipman, and he was later known as Dr. Death. Harold Frederick Shipman was born in Nottingham on the 14th of January 1946 to working-class parents Harold and Vera Shipman. His father was a lorry driver and his mother was actually a housewife, so she got to spend lots of time with Harold throughout his childhood. He had two siblings growing up, an older sister named Pauline, who was 7 years his senior, and a brother who was 4 years younger named Clive. It is reported that there was nothing unusual about Harold's childhood, actually. He was described as being pretty normal and unremarkable. His neighbours mentioned that the family were friendly, but Vera, his mum, saw her family as being more superior to others in the area, and it was obvious to them that Harold was her favourite of the three children. From what information I could find, it seemed like Harold's mother was quite controlling. It said she decided what children that he was allowed to play with, and always made sure he dressed in smart attire when other children were dressed really casually, so that he would stand out and seem more superior. Harold is said to have started off his school years as a bright and promising student, but as he advanced through his schooling, he was reported as being more on the mediocre side. He attended High Pavement Grammar School in Nottingham in 1957, and was said to have been an avid rugby player at the time. Sadly, on the 21st of June 1963, when Harold was actually studying for his A-levels examinations at the age of 17, his mum, Vera, passed away from lung cancer, and at this time she was only 42 years old. It's said that Harold used to watch the doctors administer morphine to his mother during the later stages of her cancer, and he saw how this allowed for her pain to subside while she was slowly dying. Now keep this in mind. So 2 years after his mother's death in 1965, Harold moved to Leeds in order to attend Leeds University Medical School. He later graduated from this school in 1970 and started his career as a junior doctor, but quickly rose up through the medical field and became a general practitioner, which is also known as a GP. I did read in one source that he then began to inject himself with morphine while studying at the medical school to see how his mother felt, and this resulted in his subsequent addiction to pain relief medications. But I am not 100% sure if this is the truth and how his addiction started. I can only find it referenced in one source, so please keep that in mind. During his time studying, he met a woman named Primrose Oxby at a local bus stop when he was just 19 years old, and they married in 1966 when Primrose was just 17 years old. And at the time of their marriage, she was 5 months pregnant with their first child, and they later went on to have a total of 4 children together. In 1974, he joined the Abraham Ormerod Medical Centre in Todmorden. I think I said that right. I apologise if it was wrong. And this was in Yorkshire, and he joined there as a GP. But in 1975, his criminal act actually began to show. Harold Shipman was caught for forging more than 70 prescriptions for his own use, as he had become addicted to a drug called pethidine. And from what I could find online, pethidine is a strong prescription pain relief which contains opioids, and that makes them obviously very addictive. This resulted in Harold being fired from his job as a GP at that practice, fined £600, which I worked out was approximately £5,400 in today's money, so probably about $6,000, I'd say. And he was made to attend a rehabilitation centre in York, where he could receive psychiatric help for his addictions. So the way he got hold of the drugs that he was using was he was prescribing patients slightly more of the drugs than they actually required, and he kept the remainder of it for himself to administer later on. And he often injected up to 700 milligrams a day. Usually injections are probably, I think, around 5 milligrams of actual substance. So he's injecting a lot of drugs. He was not actually struck off from the whole General Medical Council for this addiction, though, which allowed him to begin working again as a GP just 3 years later. And this was because he had actually begun his own medical practice in Hyde, Manchester, where today's case actually takes place. In the image there, you can see a picture of the surgery, and this surgery was actually abandoned until 2016 when it was demolished, and it's been replaced by a supermarket now. So next, we're going to jump ahead slightly to 1995, and we're going to start talking about the known victims of Dr. Harold Shipman. Dr. Harold Shipman's first known victim is reported to have been Mrs. Marie West, who was aged 81. She was found dead in her home on the 6th of March 1995, and it's said that Harold murdered Marie whilst her friend Marion was actually waiting in the kitchen in the room next to them. And this is because they had been having tea together just before Harold had arrived for her appointment. She went into the kitchen to allow Mrs. West some privacy during her appointment. When returning to the room Mrs. West was sitting in, Marion found that Mrs. West was sitting motionless in her chair. Harold had administered Marie with a lethal dose of diamorphine, claiming that Marie's cause of death was a stroke. She was described by her son as being very sprightly, a lovely woman with a lot to live for and many friends. Dr. Shipman had only been called to visit that day in the hopes of arranging a hospital appointment to cure a hip condition that she was suffering with. A second victim, a year later, on the 11th of July 1996, aged only 67, was Miss Irene Turner. She was visited by Dr. Shipman in her home after returning back from a holiday with a cold. She is said to have had a complicated medical history. After administering the morphine injection, Dr. Shipman told her neighbour to pack some clothes for Irene as she was going to hospital. He later claimed she had died from diabetes, but after exhuming her body, examiners found morphine within her body tissues. Family reported that Dr. Shipman was very matter-of-fact about her death, showing absolutely no remorse or sympathy when he told them about the death. He claimed that Miss Turner had refused to go to hospital, and that was why she had died, which wasn't the case at all. On the 28th of February 1997, 77-year-old Lizzie Adams was found dying by her friend Bill in her own home when he stopped to pick her up for their dancing session that they usually went to. When Bill arrived to pick up Lizzie Adams, Dr. Shipman was actually still in the room, and he claimed to her friend that she was dead. But Bill rushed over, and he was, trying to wake up Lizzie, and he said he actually could feel a pulse. Then he told Dr. Shipman, and Dr. Shipman actually dismissed this and stated that he had called for an ambulance, but then he pretended to cancel it when Lizzie was pronounced dead. When Shipman was finally arrested, police actually searched his phone call logs, and no records of any calls to emergency services were actually found. So Harold had lied about calling for an ambulance. Mrs. Adams was said to be a well-respected dance teacher and a lover of ballroom dance, who was very fit and healthy for her age. Keep in mind, she was 77 and she was still going ballroom dancing every week. That is a very, very fit individual to be able to do that at her age. It's, she wasn't suffering from anything that would cause her to die so unexpectedly. 59-year-old Jean Lilly was found deceased in her home on the 25th of April 1997 by her neighbour, who she was considered close friends with. This neighbour stated that she had seen Dr. Harold Shipman leave Jean's house after an appointment, so she thought she would go over to see how her friend was, only to find her dead in her own home. Dr. Shipman stated that Jean had died from heart failure, but her autopsy during the investigation of Dr. Shipman revealed that Jean had absolutely no evidence of severe heart problems, and the cause of death was found to be diamorphine overdose. Dr. Shipman notified Mr. Lilly, which is Jean's husband, of his wife's death over the phone whilst he was still at work, obviously showing absolutely no remorse for what had happened. Sadly, Mrs. Lilly was never able to meet her grandchild, who her daughter was pregnant with at the time of her death, and that is something that people say Mrs. Lilly was really, really looking forward to. So it's such a shame that she never even got to meet her grandchild because of this. Just 1 month later, Ivy Lamas, aged 63, passed away in Dr. Shipman's doctor's surgery on the 29th of May 1997. After poisoning Ivy with diamorphine during her appointment, she was taken to the treatment room where she was told she was being left to rest for a little while. Here in this room, Ivy sadly passed away, but Dr. Shipman actually went on to see 2 other patients before finally reporting her death to others. Harold Shipman was said to call Ivy a nuisance as she had regularly had appointments with him. He was seen joking about having a sign in the waiting room saying, "Seat reserved for Ivy Lamas." Shipman is also said to have altered Ivy's medical records 2 days after her death. Her cause of death was reported to be coronary thrombosis with ischemic heart disease, which is a weakening of the heart due to reduced blood flow. On the 14th of July 1997, Miss Muriel Grimshaw was found dead in the bed of her home by her own daughter. Mrs. Grimshaw was aged 76 at the time of her death. Dr. Shipman originally claimed that Muriel had died from a stroke and hypertension, but later altered her medical records to hide the cause of her death. When her body was exhumed for testing, it was found that she had also passed away from a diamorphine overdose caused by Dr. Shipman. Mrs. Grimshaw's daughter stated that Dr. Shipman turned up at Muriel Grimshaw's house to pronounce her dead. She stated that Dr. Shipman didn't even touch or examine Mrs. Grimshaw before actually claiming she had passed away at 5:30 p.m. on the previous evening. So I don't know how he can claim to have known. Even obviously he was the cause of it, but to not even attempt to act like you were doing it and you just, seem to know from telepathy or whatever, that's not the right thing, is it? You just know, but without even testing someone how they died. I don't even think he could do that as just a GP. He's not a coroner. Mrs. Marie Quinn, aged 67, was found dead in her home after Harold Shipman had visited her on the 24th of November 1997. She was described as being very chirpy and happy on the phone call to her family friend, Father Smith, a Catholic priest, when she just called him a few hours before her death. Dr. Shipman claimed that Marie had died from a stroke, when in reality, yet again, he had injected her with a lethal dose of diamorphine. Dr. Harold Shipman mistakenly actually went to the wrong house on the 9th of December 1997. Instead of going to the home of the correct patient, he instead went to Laura Kathleen Wagstaff's house, her preferred name being Kathleen, so I'm going to refer to her as Kathleen. 81-year-old Kathleen was injected by Dr. Shipman with diamorphine, leading to her death shortly after. Shipman claimed he had had a call to attend an appointment at Kathleen's house, but no evidence of this was actually ever found in call logs. He claimed her cause of death was due to heart disease. Kathleen's son stated that he had last seen her 2 days prior to her death. She was in really good spirits due to Christmas coming really soon. He reported her as an active lady who regularly walked a mile into Hyde Town Centre to do shopping. So yet again, another elderly person who is seemingly very, very fit. You don't see many old people able to regularly walk a mile and back to do shopping. Bianca Pomfret was the youngest known victim, aged only 49 when she sadly passed away at the hands of Dr. Shipman. He reported her cause of death to be heart failure on the 10th of December 1997. Bianca was found dead in a chair in her home shortly after Dr. Shipman had visited her for a home appointment. Dr. Shipman had altered Bianca's medical records an hour before her death to include a long-spanning report of heart problems to cover his tracks. But once again, a lethal level of diamorphine was found in her system when she was later exhumed for an autopsy. On the morning of the 26th of January 1998, Nora Nuttall, aged 64, visited Dr. Shipman at his surgery, where he prescribed her with a cough medicine. He told her to stay indoors for the next few days. Hours later, he called over to her house with the excuse of seeing how she was doing. Her son, who was visiting her at the time, decided to step out of the home for a while to feed some nearby ponies whilst Dr. Shipman was there checking on her. During this time, Dr. Shipman injected her with diamorphine. When her son returned, Nora was found slumped in her chair. Dr. Shipman was still there at the time and claimed he had called for an ambulance, but he then cancelled it when she was pronounced dead. But once again, records show Dr. Shipman never called for an ambulance at any point. He then reported her death as ventricular heart failure, telling her son that there was no need for an autopsy. He seemed to do this a lot whenever family mentioned requiring an autopsy or anything like that. He managed to persuade them every single time not to get an autopsy because people trusted him as a doctor. If your doctor says, we don't need an autopsy, we know exactly what it was, you're going to trust them. 68-year-old Pamela Hillier was said to be an active individual, often walking her dog 3 times a day. She was found dead in her home on the 9th of February 1998 by paramedics. Dr. Shipman was called to Pamela's home for an appointment as she had recently fallen, resulting in a sore knee. Her daughter arrived at Pamela's home after attempting to call her with no answer, only to find paramedics there who reported that her mother had passed away. I'm not sure who actually called the paramedics. I couldn't seem to find out who it was, so I apologize for that. I did try looking, but couldn't find it anywhere. So I'm not exactly sure how the paramedics found out about her condition. Dr. Shipman arrived soon after, stating that Pamela had passed away from a stroke caused by high blood pressure. Shipman told the family that an autopsy was unnecessary when they brought it up to him. A paramedic attending the scene was actually said to have mentioned that they believed the police should be notified of the incident, but nothing was actually done. 10 changes to her medical records were said to have been made shortly before she was found dead. These changes support the cause of death that Shipman had actually given her. So you can see he's consistently changing the records after the fact with a lot of these patients to support the bogus cause of death that he's given them. Maureen Ward's death was reported to the accommodation warden at her elderly person sheltered housing unit by Dr. Shipman on the 18th of February 1998, just 9 days after his previous victim. The 57-year-old had been suffering from cancer at the time of her death, but was not reported to be in ill health, even taking her friends washing to the laundrettes the morning of her death. Dr. Shipman reported that Mrs. Ward had died from a brain tumour, but was never actually seen examining her in any way. Yet again, her body was found to contain high traces of diamorphine when an autopsy was performed on her. Mrs. Winifred Meller, aged 73, was found dead on the 11th of May 1998. She was found sat in a chair in her own home. Dr. Shipman called up Mrs. Meller's daughter and even made her guess that her mother was dead, which is insane. Shipman claimed that Mrs. Meller was stubborn and refusing treatment at the time. He reported that she had passed away from coronary thrombosis, altering her medical records to look like she had made claims of chest pains caused by angina, a type of chest pain which is caused by a lack of blood going to the heart. On the 12th of June 1998, Mrs. Joan Melia had been visited by Dr. Shipman at her home due to suffering from a chest infection. Her appointment was actually booked in for the next day at the surgery, but Dr. Shipman turned up the day before. The 73-year-old was then found dead later that same day, after Harold has visited her home to check up on her. Joan's cause of death was labelled as pneumonia aggravated by emphysema, but in reality she was injected with a lethal dose of diamorphine yet again. Dr. Shipman told Mrs. Melia's daughter that she had come to his surgery a day prior and he had told her to rest at home, but she had ignored him to go shopping, which then resulted in her death. Which to me makes no sense. Harold Shipman was finally caught for his heinous acts when Kathleen Grundy, aged 81, was found dead in her home by 2 colleagues at 11:55 a.m. on the 24th of June 1998. They had decided to visit her home after becoming worried that she didn't turn up for her pensioners' luncheon club. Upon arriving to Kathleen's home, they knocked with no answer, but found that the door was strangely unlocked, so they let themselves in to make sure she was okay. Upon entering her house, they found Kathleen curled up on the sofa as if she was asleep, but called Dr. Shipman to come and check Kathleen as she looked really grey. He pronounced her death as being caused by a cardiac arrest due to old age. This all occurred just a few hours after Dr. Shipman had visited her in her home for a routine blood test at approximately 8:30 to 9 a.m. But instead of drawing blood during this appointment, he once again administered an injection with a lethal dose of diamorphine. Kathleen was a well-known member of a local community, being a former mayoress of Hyde. She was described as being a highly respected, vibrant, energetic, and happy individual, involved in a host of social activities such as running a local lunch club twice a week. She was described by a close friend as a marvelous lady who would do anything to help anyone. Only 2 days before her death, solicitors had received a badly typed will, apparently from Kathleen Grundy. These solicitors said that they had never dealt with Kathleen before this time, and this will included that her whole £300,000 estate was to be provided to Dr. Harold Shipman when she died. This excluded her daughter and grandchildren, who she was very close to. 8 days after Kathleen's death, they contacted her daughter regarding the will. Her daughter was very confused, as she was also a solicitor who had her mother, Kathleen's will, in her possession at that very time, and the will had actually been created 10 years prior. In this picture, you can see Kathleen Grundy's daughter, and she's named Angela Woodruff. They found out that the two people who had signed the will as witnesses were tricked into doing so by Harold. They were both people who were there for regular doctor's appointments. They were asked by Harold to witness the signing of some documents, which they obliged to as they thought nothing strange of it. Harold passed them a folded document to sign. The document was folded in a way that the individuals signing it couldn't read the contents, but the individuals reported that they didn't ask what was on the document due to privacy concerns for Kathleen Grundy, who was also sat there with them at the time. Harold had told Grundy that she was just signing to authorise that she was willing to take part in a survey on ageing from Manchester University. Kathleen's daughter reported what was happening to the police, and an investigation was opened. Here you can see a picture of the forged will, which Shipman had made, and it reads, "All my estate, money, and house to my doctor. My family are not in need, and I want to reward him for all the care he has given me and the people of Hyde. He is sensible enough to handle any problems this may give him." Greater Manchester Police actually first investigated Dr. Harold Shipman on the 24th of March 1998, and this was due to a report that a large number of Harold's patients were passing away due to strange circumstances after meeting with him at the doctor's surgery that he owned. The local funeral directors also noticed that a lot of deaths were coming from Harold Shipman's doctor's practice. They noted that a lot of the individuals were elderly women with no terminal illnesses. The majority of them passed away sat in their chairs, which is really abnormal for someone who is ill enough to die, as they'd usually be resting in bed. The Chief Detective Inspector concluded that there was no substance to the concerns reported, stating that the high volume of recorded deaths was due to the high number of elderly patients which Harold Shipman dealt with at his doctor's surgery. Because of this, they closed the investigation on the 17th of April 1998, 25 days after it actually began. It's so frustrating. If they just looked into it, they would have solved this quite a while before they did. 1 month after Kathleen Grundy was buried, on the 1st of August 1998, police exhumed her body in secret in the middle of the night. Her remains were sent off for post-mortem examination, with the scientists finding high traces of diamorphine within her body tissues. Harold Shipman's home and doctor's surgery were also raided in order to find evidence, such as the typewriter which was used to type out Kathleen's forged will. Harold actually showed the police where the typewriter was in the cupboard of his doctor's surgery after they had read out the search warrant, which mentioned that they were specifically looking for a typewriter. When handing over the typewriter to them, one source, a book named Harold Shipman, Prescription for Murder, stated that Harold mentioned, quote, "Mrs. Grundy borrows it from time to time. This shows that he was well aware of why police were asking for the typewriter." Experts quickly found out that Harold's typewriter had been used in order to write the forged will, as fingerprints matching Harold's were found on both the will and the typewriter, but none from Kathleen or the two people who were supposedly witnessing the signing of the document. The picture shows what the typewriter would have looked like. It's not an exact one, as all of those pictures are actually copyrighted for some reason, but if you want to do a quick Google search, you can see a picture of the exact one, but it is literally the same. In 1998, a local taxi driver named John Shaw reported to the police that he had noticed that a lot of his regular customers were passing away shortly after he had dropped them off for an appointment with Dr. Shipman. He states that he had been suspicious of Dr. Shipman for many years, suspecting Shipman of the deaths of 21 people. He was told to keep quiet about these thoughts by his wife, as she feared that they would be sued if the accusations were incorrect. He states that he feels great guilt about failing to report the concerns, as he believes many people may have died because he failed to report them, which at the time he thought were crazy thoughts, as Dr. Shipman was so well liked and respected in the community. Not only did Harold selfishly kill Kathleen, he also then attempted to taint her image in order to cover his tracks. He did this by reporting that she showed symptoms of drug abuse in prior doctor's appointments, specifically codeine, which can actually be broken down into diamorphine or morphine after death, the very drug in which he used to kill his victims. So he really thought about this. He even went to all the effort of changing it to, suspected codeine addiction, because he knew that that's what the drug would be broken down into. And he thought that could explain away why it was found in the body if someone was given an autopsy. So I'm just going to talk a little bit about diamorphine, which is the drug that he used to kill many of his victims, or all of his victims, all of the known victims anyway. Diamorphine is an opioid drug, which is used as a very strong and very effective painkiller. It's a semi-synthetic drug, partly derived from the opium poppy. Diamorphine is administered via injection into the skin, with a normal dosage taking up to 20 minutes to take effect. Dr. Shipman was said to have been administering 20 to 30 milligrams of diamorphine to the patients he killed. This is up to 6 times the recommended 5 milligram dose for pain relief. It's reported that the effect of the drug would be even higher on the elderly, especially those that weren't experiencing any pain at the time. This huge dosage would begin taking effect after only 2 minutes, making the patients fall asleep and eventually stop breathing, leading to their deaths. Even though pharmacy records show the amount of morphine that Dr. Shipman was prescribing and using on his patients, this was, for some reason, failed to be picked up by pharmacy staff. I don't know how they didn't pick this up. Were they just not looking at records, not looking at how much was being prescribed? Did they not know how much of a crazy amount that 20 to 30 milligrams was? Which, as a pharmacy worker, you would expect to know what dosages of drugs people should be given on a normal basis. There's absolutely no excuse for this not being picked up at all. Harold's sentencing began on the 5th of October 1999, where on the 31st of January 2000, at Preston Crown Court, after the jury took 6 days to deliberate, he was convicted of the deaths of all 15 of the victims we talked about earlier. This resulted in him being sentenced to a full life order without any possibility of ever being released, and he was sent to Franklin Prison in Durham. So the image you see here is a court sketch of Harold Shipman during his trial. So in the UK, recording and photography is not actually allowed within court, so sketch artists are actually still used. In 2003, Harold was brought to Wakefield Prison so that he could be closer to his family, allowing for easier visitations. But on the 13th of January 2004, at 6:20 a.m., Harold was found dead in his prison cell. He had actually hung himself by tying bed sheets to the window bars of his cell, although some people do speculate that he was actually murdered in his cell rather than committing suicide. His diary was found after his death, and it was reported that he had been having depressive thoughts for quite some time due to being separated from his family. It's thought that he may have done this in order to help his wife, who was currently struggling financially. Harold found out that if he died before he was 60, his wife would receive a lump sum payout of £100,000 and a yearly pension of £10,000. But if he lived beyond 60, she wouldn't receive any lump sum and would only receive a yearly pension of £5,000. So it's not confirmed that this is the reason. Obviously, we never know why. You'd never know why, but that is the thought. There's speculation that Harold may have killed hundreds of people in total, with some reports stating a possible 218 victims, but out of the 500 patients who had died whilst in Harold Shipman's care, only the 15 victims we spoke about today could ever be proven. Some people believe that his first victim was actually Margaret Thompson, who died at the age of 67 in March 1971 whilst recovering from a stroke, but this could actually never be proven. Harold Shipman is now said to be one of the worst serial killers in UK history, killing a proven 15 innocent people and suspected of killing up to at least 218. The motivation for his killings still remain unknown, as only the final murder had an attempt to obtain any form of monetary gain, meaning that Harold is just a sick and twisted individual who took joy in taking the lives of innocent elderly people, all who trusted him daily with their health and private matters. With Detective Chief Inspector Mike Williams, who interviewed Harold whilst in police custody, stating, quote, "He likes control, and the ultimate control is over life and death." There is one positive thing, I guess, that has come from Shipman's heinous acts, and this is the update of the extremely outdated NHS procedures. So if you don't know, the NHS is the National Health Service in the UK. It's the countrywide free health service. And that's what Harold worked under. And this update required for coroners to be better trained, and more controls were put in place for the distribution of dangerous drugs and pharmaceuticals, with extra monitoring on how drugs go from the person prescribing them to the patient. It's not really a positive. The fact that that many people had to die in order for this to actually happen is really sad. It's something that should have been done anyway, but like a lot of things, it always seems like something horrible has to happen for any action to actually be taken on anything like this, and it shouldn't be that way. I just want to say thank you for taking the time to watch my content. I really hope that you have learned something new today. If you're enjoying this style of content, please make sure to give the video a thumbs up, leave a comment down below with any case suggestions, and subscribe to me here on YouTube. Every little bit of engagement from you guys really helps my small channel to grow, so I really appreciate every single one of you so much. Also, if you haven't already, be sure to check out my Twitch channel, where you can find me live several times a week. You'll find that on screen now or down below in the description box. I do hope you all have a wonderful rest of your day. Thank you all once again for your support, and hopefully I can see you guys very soon. Goodbye!